I did things for free for way longer than I should have. As pharmacists, we're really bad about that. And when I stopped doing that, my business went to the next level.
Today, we are talking with Dr. Victoria Reinhartz, and she's transforming what a forward-thinking PharmD can do. When Victoria was in college, her house collapsed, and it was a lesson in navigating the unknown, and she's still doing that beautifully to this day in so many different aspects of her life. She creates amazing YouTube videos. She's just a fun, real person, and she is transforming care for our patients across the country. And she's just a good friend of mine. I'd like you to meet Dr. Victoria Reinhartz.
Oh my gosh, thank you for having me. And of course, we'd start out of the gate with a super fun fact about my background in college, right?
Yeah, so tell me about that. I don't know this story. Tell me about that and about college and the beginning of your career.
It is a fun story. So I went to college in the Atlanta, Georgia area, and I lived by myself. Not too many college students live by themselves, but I did. I rented this little A-frame house, and I got a good deal on it because it was across the street from a rock quarry. I don't know how familiar you are with rock quarry. Do you know what that is, a rock quarry?
Mm-hmm.
Yeah. So if anybody's listening and you don't know what a rock quarry is, so when you have concrete trucks and concrete being created, they have to blast dynamite out of, they blast dynamite and get all the rock and materials that they need to make concrete. And so that is typically referred to as a rock quarry. And it's usually this gigantic, deep pit in the ground that they blast dynamite and collect rock from, right? So it was across the street from multiple concrete companies and a rock quarry. And so super affordable because the ground shakes a couple times a day when they blast dynamite to make concrete, and lots of trucks on the road in front of the house and things. But I loved it. It was really a fairly big house to live there by myself. But I guess, it's finals week. I think I was a sophomore in college, and it's finals week, and I come home from a Christmas party in December, and the whole road is barricaded off, and they're like, "This is now a condemned area, ma'am. You cannot get through." And I'm like, "Okay, that's funny. I live here though, so you got to let me through." And they're all, you don't live here anymore, ma'am.
That's how you found out?
That's how I found out, yeah. And so turns out they blasted one too many times, I guess, or whatever. And the ground kind of split apart, and the houses that were on our street essentially kind of caved in to big, gigantic earthquake style, holes in the ground. So yeah, that happened during finals week when I was in undergrad. And it certainly is a fun fact now looking back at it, but it was a pivotal point in my life where you just lost everything, right? I lost everything out of that house, and even my books and clothes and everything. And it was an experience in kind of navigating, well, this was not something I saw coming. And what do I do now? And how do I navigate this and find new resources and still figure out how to troubleshoot to succeed at that time was a really important week in my life, right? Finals week. So yeah, it was certainly a big challenge in college. And it's one of the experiences I look back on now as a big, all right, let's see what you're made of, right? Let's dig deep and find out what you're made of moments there. So.
Oh my gosh. And you just lost everything. Did they even let you? I have so many questions. Did they let you back in there? Or is it like, sorry, whatever you're wearing is all you have? Have a nice day.
So essentially they're, in looking back now, they have disaster management teams and all of these things, right? There was we're going to go in and grab anything for 5 minutes or whatever it is. Is there anything specific that you want grabbed? So yeah, essentially everything was gone, right? All the clothes, half the house was already completely, essentially, not even accessible. So yeah, it's fine. Luckily, I was in college and there wasn't anything too critically important, but all the furniture, all the clothing, any and all of those elements were gone. I was fortunate to have an extra change of clothes because I had stayed with a friend over the weekend. So, and luckily I could still access my, the very small amount of money I had in my bank account at that time, and went and stayed with friends and those sorts of things. But yeah, definitely a wild story. It was kind of crazy.
Well, tell me more about college and your career, because you got your PharmD and
I did.
you're on a pretty traditional path. And now look at you, like you are doing nothing traditional at all. Tell me about that.
Yeah, so I went to undergrad pre-pharmacy, right? I had an interest in accounting, and in business, but I wasn't really sure what I wanted to do. I was working part-time as a pharmacy tech, fell in love with it when I started that role and said, I want to go to pharmacy school. Went to pharmacy school at LeComm School of Pharmacy down in Bradenton, Florida area, got my PharmD, and I started in retail. So I was a Target pharmacy manager back when Target Pharmacy was a thing. And that was my plan. I enjoyed retail. I knew a lot of my patients and I was good at it. And it was still during the time frame that, 2010, 2015, that time frame, that there were even more resources in the retail setting than there are now, of course. Mm-hmm. So it had started to get bad, but it was my game plan, right? I was going to stick with it for a little while, but I did recognize that I wanted to continue to develop myself. And I started really early on making sure that I didn't get complacent with self-developing. And so even though I was in the management role, I said, how else can I develop my own skills so that if I ever want to get out, that I can? So I started, doing more things with the local college and hosting student events and coming in and doing guest lecture type events to teach students how to immunize and other activities with the students. And then I took on a couple regional related district resource type roles where I would lead an initiative, team training or rollout or whatever that looked like to develop additional skills. And again, I think it just started to live in my heart that I recognized I wanted to teach, and I eventually ended up being able to leverage that experience with the students and pursue an opportunity to go back and get into academia. And so then I went into academia for a few years. I still have a part-time role at LeComm as faculty, and I still love the teaching, but essentially, it was a big jump even from academia to what I do now. And so what I do now, and I can share this if it feels like a good time to you, I'm happy to share.
That's perfect.
So, how in every community we have underserved populations or people that they don't have a primary care doctor, or they're uninsured, or they can't get back and forth to their doctor for whatever reason. They can't access the care that they need. And so these patients go for months or years or decades without care. Their diseases get worse. And then they get stuck in that cycle that we're all too familiar with, where they call 911, they get transported to the ED. Then the ED says, here's something for your blood pressure or your blood sugar, and follow up with your primary, but there is no primary. And so they get stuck in that nasty cycle, right, of bouncing back and forth to the hospital. And we know that's expensive. It's expensive, and nobody gets the care that they need. And so now what I do is I actually work to train and develop mobilized healthcare teams so that we can send that paramedic who would typically come on an ambulance. Now we can send that paramedic to visit that patient proactively, identify, right, that they're at risk for a 911 call coming up, and intervene ahead of the curve, right? So find out where they're falling into the river, and let's prevent them from falling in upstream. And let's resolve whatever issues, medical, social, right, psychological, whatever issues need to be addressed, let's see if we can get that patient those resources so that we break that cycle. So that's what I get to do now. And it's really a perfect blend of, my clinical experience, my teaching experience, and I get to do it in an entirely new industry.
Yeah, you're like making your own industry because there's such a huge need and there are resources there. Paramedics are in the community, they're helping people, but especially from my experience, never considered a paramedic could help like before the problem hits instead of like, oh, heart attack, now we go. Oh, lady's broken her hip, now we go. To use those resources in a different way. I love, love, love what you've created. And especially as someone who you could think was outside of that system, like you're a PharmD, you're not necessarily, I don't know, are you even a medic by training? How did you merge these worlds? And like, how did you create this blue ocean?
I know it's really unique. There's not very many PharmDs in this industry. So this industry by title is mobile integrated health. So we take paramedics, right? We give them additional training and support specifically through Mobile Health Consultants, which is my company, and the education division of what we do, which is the MIH Academy. We help to get those paramedics board certified in something called community paramedicine. So we're essentially taking the skills of a paramedic and now we're deploying them with additional training and resources to serve community need, to serve public health need, right? So community paramedicine is then a component of mobile integrated healthcare where we take those amazing community paramedics, we partner them with social workers, with nurse practitioners, with pharmacists, with physicians, whatever it is. And now we have the entire mobilized healthcare team. But as a pharmacist, it's not a traditional career path. It started really organically in the sense that I was working in a public health realm. So I was working in a Department of Health and I was doing tuberculosis management, immunizations, women's health, underserved populations in public health. And I was brought in to help provide some guidance and shaping of a community paramedicine team because there was such a gap and such a need and so many patients stuck in that cycle of calling 911 and using these ambulances when it really wasn't a true emergency. They brought me in and said, what do we need to know about the chronic disease side? What do we need to know in a community paramedicine team about the medications? And I'm sure you can relate to this, right? We're ideas people, Jamie, you and I, right?
Yes, we are.
So it's what we do best. And so I said, well, hey, EMS chief, why don't we try this crazy idea where we partner the paramedic with a pharmacist? And let's just see what impact can be made. So we did that. So James Crutchfield was the very first EMS chief that said, yeah, let's do it. Let's send my paramedics with a pharmacist right into the patient home. We did this for a couple of years. And our first pilot project tracked data over 3 years. And in 3 years, we saved over $5 million in prevented costs. Yeah.
Just in that little baby of an idea?
Yeah. Yeah.
Oh, gosh.
But see, it took an innovative leader to be able to say, yeah, let's do that. Let's partner an emergency responder, a first responder, with a pharmacist, a chronic disease management expert, right? And so it was that innovation that leader had. And it was, me saying, this is crazy. I know this is crazy. Nobody does this. There's no pharmacists that are walking into patients' homes with a team of first responders, right? And, together a great idea was born and a huge impact was made. And it essentially changed the scope and practice of what I do now on a daily basis. And it has also changed the scope of what an entire nation is recognizing that first responders and pharmacists are capable of together. So it's kind of been an incredibly beautiful thing to now be a part of. And now I've partnered with Rainbow Health, which is a care coordination platform and health services company. And now through the Rainbow Health platform, we have first responders anywhere in the nation that can dial up a pharmacist whenever they have a medication-related issue for their patients.
I love that, which probably happens very frequently. As pharmacists, we know what good and havoc medications can do on patients. Mm-hmm. I love this.
Yeah, it's pretty incredible. And the average patient that is seen by these teams, right? So the average patient that falls into that rut of calling 911, going to the hospital, getting discharged home without the care and the resources they need. You know, you look at that patient population, you come in and you do a really thorough medication review and start to track and follow that patient for a period of weeks. They, on average, have at least 4 different medication-related problems. That's probably even the ones that are fixable, right? So there are going to be some medication-related problems that no matter what, you're not able to resolve that. The patient won't stop taking the medication, or the patient is not adherent and they vice versa, right? They refuse to actually start taking their medicine. But drug interactions, doses that are wrong, you name it, right? Any and all of the medication-related problems that we see, huge risk for emergency department visits and hospitalizations, and we're able to successfully address those. So the medications are a huge issue, in addition to just the patient education component and all of the other side benefits now that the community paramedicine and mobile integrated health industry is finding as a result of partnering with pharmacists.
I love that you're doing this, because so many times when I was on the other side of that retail counter and I would give like these cute old couples like a giant bag of medicine, there's like 20 pills in there, and like they don't know what they're all for or when they're supposed to take it. And like, I'm pretty positive when they're laying out their dose for the week, they're just kind of like pouring it in the holders, and like, I hope we're getting the right amount. And like, just seeing that like there's such a problem, but there's not much I can do in this role to help other than worry about them. And so to see that you're creating solutions to actually help these people rather than just setting them up for failure and going through the broken healthcare system. You're changing that. I love this.
That's what we're aiming for. And, you know, I'm just one individual in this industry who's making a huge difference. We know that, you know, when I started the pilot down in Manatee County, Florida, there were probably, I would estimate, probably about 60, maybe up to 80 programs across the nation. There's hundreds and hundreds now across the U.S. in every state. And we have had an immense growth in multiple organizations now that are focused solely or expanding in this area of mobile integrated health and community paramedicine. You know, we have companies like Rainbow Health now, like my own company, that this is the primary target for them as a business initiative, right? Is working with the intersection of primary care and first responders to help provide solutions for social determinants, medication-related problems, chronic disease management, all of those pieces. And of course, the National Association has now been established for mobile integrated healthcare providers, which we lovingly call NAMIHP, NAMIHP. It's too much of a mouthful, so NAMIHP. And, you know, I've been fortunate enough to serve as one of the founding board members for that. And we're talking about 2 years now, in a little over 2 years. And we have expanded now to over 230 agencies in 45 states.
Oh my gosh. Wow. Wow.
It's been just incredible, the amount of growth and the need and the success of these programs. So if anybody is listening to this podcast and you're in, you know, primary care or working for health plans or whatever it is, and you're realizing that, you know, it's costing you a lot of money for these expensive patient populations, and you're trying to figure out how to launch a program, to touch base. This is the shout out, the call to action. We can help you. I can help you. So.
And Kay, keep bragging about this. Tell me what your company has turned into and what services you offer, because you do a couple of different things to help in a number of ways.
It is a couple different things, which is always hard when you start, right? It's a hard lesson to learn doing more than one thing when you start out. But, we've been fortunate to have pretty organic growth, which has been really fun. So, there's two big arms of what we do. One is the consulting side. So if there are, health systems or primary care groups or health plans or even fire and EMS agencies that are realizing that you're spending thousands and thousands sending, your ambulances and your very small staff, because there's understaffing everywhere is a problem, right? If you're finding that you're spending more money than you should on calls that are non-emergent and sending an ambulance there unnecessarily, or suffering the costs of funding that in high utilizer populations, then we help you develop out a program. So we identify what populations are in highest need, and we help put all of those pieces together, protocols, figuring out how patients are going to get enrolled and referred, and how you're going to develop care plans and track your outcomes and all of those pieces, right? Everything that goes into developing a mobilized healthcare program that will have a net reduction in cost and a net improvement in patient outcomes. That's what we do on the consulting side. So it's so fun because there's no two programs or no two communities that are exactly the same, right? Every city or little community is a little different. So the program development piece or program evaluation piece is super fun on the consulting side. The second part of what we do is on the education side. So, I went into academia a few years ago in 2015 and teaching pharmacy students. And of course, LECOM is a college of medicine as well as a school of pharmacy. I fell in love with academia. I am super passionate about education. And we said a few years ago, why not expand that to paramedics? Paramedics have what is, very apparently way more barriers to high quality education and training and resources and the development that they want and need, even compared to pharmacists and nurses and physicians. And so paramedics, they wanted more information. They wanted more knowledge and education, and they wanted to get board certified, and they were struggling with that. And so we created the education arm, which is the MIH Academy. And now we have multiple education offerings that we do through the Academy for, teams from all across the US.
Just listening to you talk, Victoria, we graduated about the same time, and we both started in retail. And I feel like, oh my gosh, how did you accomplish this much? Like, I am so behind compared to you and what you've created. I'm just curious, what do you attribute to your success in business and to be able to have do you even have an MBA, Victoria?
No.
You don't have an MBA. I assume you don't have prior robust business experience. How did you get started so strong and to build a company organically that is just taking off? What would you attribute that success to? And I'm just in awe of this.
Well, I feel the same about you all the time, by the way. We all do. All of it. You, I feel like, inspire so many of us that are also in this, solopreneur or entrepreneurial space. And, I think the take-home point here is that you really do have to continue investing in yourself. And you also have to continue investing in whatever initiative you want to be profitable. Even just in working with you for so long, how many conversations have we had in the past where we, are trying to figure out what is the hard thing that we're dealing with in the business, that I don't know how to solve this problem, or I don't know how to figure this out, and how do I get around it? And so many times I'm like, Jamie, how did you do that? And you were like, I hired someone to do it because I didn't know how to do it. And so that to me was a big component, is investing in myself either via coaches or in development programs or, different systems where I'm learning new skills and new capabilities. And we're not talking a couple $100 here. We're talking tens of thousands of dollars invested in ourselves. And there is a lot of the time really a link to you get what you pay for in some of those scenarios, because it was really once I started going into the fives and tens of thousands of dollars and investing in myself that I really noticed a huge increase in the level of skill that I'm developing and the knowledge of who's teaching those courses and those programs. It really has been incredible. So you have to invest in yourself, and that can be difficult to spend money on and prioritize. The other thing is you have to be able to invest in the business, right? So if you don't know how to do something, you can figure it out. If you're listening to this and if your intention is to be a wealthy white coat here, if you've achieved anything in the white coat arena, or if you're in healthcare, you're probably not an idiot, and you probably can do anything you set your mind to. But should you spend all of your time and energy learning how to do something new at a mediocre or even okay phase when you could hit the ground running by bringing somebody else in who has that skill set? So that has been the other piece for me, is just spending the money to hire someone else to do it. You don't have to do it all yourself, right? So,
which is hard. It's control freaks. And especially when you start your company and it feels like your baby, can be so hard to give that up. Not only for money, but just because you feel like no one can do it as well as you. But that's something you've been able to do pretty quickly, to create a framework that works and standard operating procedure, and then be able to give it away, which to have a healthy company, you've got to have replaceable roles. You can't be doing everything. You've done that really well, even though it's not easy, and it is not a smooth, magical process of just delegate.
It is. And I still struggle with it. I still struggle with it all the time. You know me fairly well, Jamie, because we've been friends now for so long, and I like things a certain way. I do, but I have really high standards where I hold myself to, right? And what kind of product I put out. One of the underlying philosophies when I established Mobile Health Consultants. So in our logo, we have excellence, innovation, and expertise. And from an excellence component, really how do you define that? And personally, I define that, and the culture that I want to lead within MHC is that we go above and beyond. We get it done plus some, right? So we deliver for clients, but we also over deliver wherever and however possible. And that's a personal standard that I have found over the years that creates a lot of satisfaction with my own work as a pharmacist, as a clinician, and now as a business owner, right? So the flip end to that is, how do you uphold that within your business as part of your culture, as part of what your promise is to clients, and as part of the standard or the level that you hold yourself at, but also then delegate it to somebody that may not get it up there, right? And so it is a really difficult thing to try to balance. There has been some comfort that I have found in this concept that teaching somebody to do something at the level and expectation that you would do it yourself takes 30 times as long.
Okay.
So a task that takes you 5 minutes, right? You teach someone else to do it. It's going to be, 150 minutes worth of coaching and kind of editing, and here's how to do that better, and here is exactly how I would do it. So giving some grace, knowing that this is going to maybe not be at the standard that you want it during that time frame of growth is really important. And this is something I learned from you, is that creating a really robust training process. So how-to videos are processes that you walk your team through before delegating to them. Those are all different strategies that I've come to embrace now as part of it.
I love it. Yeah, I'm like maxing out my Loom account with all of the videos I create. Like, oh, here's another thing. Let's walk through it. I'm a visual person, and it's nice to have tools and software that make our life easier. 2 more questions for you. One, just a really short answer. If you could talk to yourself back in 2015, and like just go whisper in your ear, what would you have told yourself back then that you wish you know about your potential for what you could create?
Imperfect action is really critical. You can go above and beyond, which for many of us, 80%, right? That's 80% is still far and above what anybody else would ever expect. But you have to make forward progress. So I think that's definitely something that took me longer than I'd like to admit to recognize. The other piece of it is I did things for free for way longer than I should have. And as pharmacists, we're really bad about that. We do that all the time. We give away our value for free. And when I stopped doing that, my business went to the next level. It demonstrated to everybody else the value.
Did you find that like it's way better relationships working with people when they're actually paying you on both sides, that you get better customers, better everything when there's that transaction?
Incredible. It's really incredible. The relationship is totally different. You're able to set clear and defined boundaries so much easier. There is no underlying resentment, right, about what you're doing and you're not getting paid for, and do they appreciate you, and all of those aspects. It's been a big game changer. And to just keep the price, this is the price. This is what it costs me. This is the value you're getting. That's what it is.
I love it. Okay, final question, Dr. Reinhartz. You are clearly a wealthy white coat. What is the one thing that you're working on now that gives you the most energy and that just genuinely is exciting and fun to you?
This one is so hard. I love everything that I do. And no day is the same. No day is the same because half the time you're doing education, half the time you're doing consulting. I would say that the MIH Academy, the education side of what we do has really taken off. There has been such an immense growth in that right now is really lighting my soul on fire, right? That we're hitting so many different teams around the country. We've now had over 700 paramedics around the country that have either, purchased our courses, engaged with our content, gotten board certified, and our pass rate is the highest in the nation now. So, it feels really at this point that we have nurses that are wanting education, we have pharmacists that are wanting education, and so we can expect a lot of growth in the MIH Academy upcoming. And then, of course, if you're a pharmacist and you're listening to this and you're looking for new roles, literally, if you want to be a resource for first responders across the U.S., connect with me, get in touch with me, because there is no other entity that's doing exactly this and really coming through for that neediest population to make a huge impact on public health outcomes, on patient care, on the population that is most vulnerable in our communities. So if you're looking for that perfect blend of remote work that's making an impact at the forefront of our license, yeah, definitely touch base with me.
Which was a perfect segue into all of Dr. Reinhardt's links to get a hold of her and to see the awesome content she's creating. It are just in the show notes below. So, which you're like, oh my gosh, I gotta have this girl in my world. Click on those links below. Thank you so much for joining us. And not only for the impact you're creating, but that you've shown how you can just create something that didn't exist before. And people are so drawn to that, and that you can actually, not only is it like a really good professional move, but you actually love what you do and it's a joy to work. I think that's one of the greatest wealths in my life, is just that I just love what I do, and it's not just clocking in for a paycheck.
Yeah, find your ikigai, right?
Exactly. We could have a whole episode on that. Well, thank you. Have such a good day.
Thank you for having me. This has been long overdue. So I love everything that you're working towards and the resources you provide. It's an honor to be your guest today.